Hi, I'm Scott Lawrence, and I'm the medical director here at Pine Cove, and I'm responsible for ensuring the health and safety of the campers and the staff. What we do here at Pine Cove is we have a clinic at each one of the camps that's staffed by an RN, and they do the initial assessment of each of the campers or staff that happen to be sick or injured. If they feel it's necessary, based on the protocols, they'll send them up to our centralized medical facility where we'll have either a mid-level or a physician do a further evaluation and treat them. The spread of illnesses at a camp is of primary concern to a medical director, and what we've done is we've implemented aggressive hand washing. It's done especially before every meal. They go through the hand troughs and wash their hands with soap and water. Then we have hand sanitizer that are on the tables. That's probably the #1 way in which we prevent the spread. If we ever have a camper that just happens to get ill, then what we do is we go into that facility, we do a deep sanitizing clean of both the cabin that they were at, as well as the washing facilities that they used. Influenza A is a seasonal virus that we see every summer. Unfortunately, this year we've seen a subtype of influenza A called swine flu, or H1N1. And since this outbreak, we've been monitoring the CDC and what their recommendations are. And what we saw initially was, or what we thought, was that this virus would be very aggressive. And fortunately, at this point, it hasn't mutated and the symptoms tend to be fairly mild. What we're doing is we're exceeding the current CDC recommendations in terms of prevention and screening, and we're screening every one of the patients that we think have a potential for influenza with a 15-minute screen that determines whether they have influenza A or influenza B. And if they have influenza A, we notify the parents and we treat that patient appropriately. The last thing that any kid wants is to be sent home from camp. Unfortunately, we've had to send some home who have tested positive for influenza A, which means they have the possibility that they might have H1N1. And we have had to send them home. And when we do, we've done follow-up with many of those a week later to talk to their parents to see how the child has done. And all of those symptoms have been mild and have resolved. One thing you as parents can do to help us is don't bring your child sick to camp. If they've been sick in the last 24 hours, run a fever, go ahead and call 877-4-PINE-COVE, and we will see if we can set them up with a later camp date this summer.